Okay, so today we're going to be talking about gas and gas administration in ophthalmology. So if a surgeon in huddle is saying they're probably going to use gas, we have two different types. We have octafluoropropane and we also have sulfur hexafluoride. So just confirm which gas you want to use. One will always live on the stand on top of the gas cart, and the other will be in the third drawer down. So just store that there. The thing to remember about these gases is they're obviously in a compressed cylinder, so try not to drop it, avoid getting it heated. It can be extremely cold coming out of the tip, so to avoid frostbite, avoid touching the tip. And it's non-toxic. The only way it could probably really harm you is it can displace oxygen. But again, we're usually only working with 60 mil to 10 mil to 3 mil amounts, so it's pretty safe to use. Just to be cautious and read the warning labels. The important thing to also remember is we should be checking the expiration date before we use it. It is located down here on the label, so this expires November 2021. If you find that the cylinder is getting empty or is close to its expiration date, just let the Ophtho CRN know, and I'll get a hold of the lab-tician to replace it. In terms of the canister setup, there are three components that you can control as the nurse. There is the on switch that goes from the cylinder to the circuit. There is the pressure regulator, which will control how much force the gas will come out into the line. And then there's the on button from the circuit to the line. I know it sounds like a lot, but it's actually pretty easy and straightforward once you get the hang of it. So now that we've gone over the circuit and the cylinder, I'll show you how to set up the line. So to help you out, there'll always be a photo of how to set up the circuit, just to make it easier for you guys, or of course you can watch this video. This is how Dr. Ma likes his gas setup. The thing to note is, notice that this syringe is a 3 cc syringe. This will be what the syringe he uses to administer the gas. So I'm going to open this up. In the top drawer, there are gas packs located here, and the contents of which will have everything you need to administer the gas. So anything that's in the packet, you can open to the scrub nurse. Okay. The other thing that is important to remember as the circulator or the AR nurse is to grab one of these wristbands, because they'll have to be put on the patient after the case is done and before you drop them off into ACU. But I will go over that more thoroughly later in the video. Okay, so we are going to open up the contents of the gas pack to your scrub nurse. I have another video where I kind of go over what the contents of the gas pack is. So I'll just open all these up and then we'll go from there. Okay, so now I've opened up all the contents of the pack to the scrub nurse, and I'm just going to show you how to assemble the circuit. So you'll have gotten a 3-way stopcock. Notice that the off is towards the center port. That's probably where you want it to start. That is where the 10 cc syringe will be plugged in. The next thing you can do is you're going to have your 3 cc syringe. Especially if it's Dr. Ma, he always applies his gas with a 3 cc syringe because he uses pure gas. So you're going to take your air filter and you're going to put that on the 3 cc syringe. You're going to put it back and forth just to get rid of any impurities, and make sure the plunger is pushed in when you apply it to the stopcock. That's going to go there. The next thing you're going to have is you're going to have a female to female lure lock adapter. You want to make sure it's female to female, otherwise it won't connect to the gas tip. Sometimes in the past male to male have gotten mixed in there, so just make sure it's a female to female. Okay. That is going to go on the end of your IV extension tubing. And then that this end will go onto here. Now, as the scrub nurse, you're going to hand this end off to your circulator, and your circulator will be responsible for connecting the circuit to the end of the gas line. Okay? And again, you'll have a photo showing you how this setup looks, so you can use that for comparison. Okay, so we've connected the circuit together. We have moved the off to the administration syringe because we want to dispel any air or impure gas into this syringe to make sure that when we administer, the gas is as pure as possible. So we're going to come back up to the cylinder. This turns the gas on to the circuit, so we're going to loosen that, which I've already done. And it's just engraved on top what way to turn the knob to open it. Next, we're going to look at our pressure. So it's a little bit above 5 right now. Dr. Ma likes it closer to 10. So we'll just turn this to increase the PSI. I think that's good enough for now because it's going to be a very quick process once we turn the gas on, and we'll show you how fast it can go. So we've got the gas pressure that we want. Now we're ready to turn on the gas to the line. And I'm just going to have the camera go to the 10 cc syringe to show how fast the process is. So it's going to go very quickly, and the gas actually expands. So when you turn it on, it's just going to be very quick on-off, I think, to get what you want. And I'm going to do that now. So if you notice, that was a very quick on and off for the system, and the gas also expands a bit, so it didn't take very long at all to fill that syringe. So now we can be confident that we've dispelled any air from the line into the syringe. So we're going to take the stopcock and move the off to the 10 cc and just ensure that there is a free-flowing line to the administration syringe. And we're going to just do the same thing again. We'll look at the gauge. PSI is still high enough, so I'm just going to turn this quickly on and off again to get the gas for administration. It's going to be very quick on-off. And you'll notice gas has filled this syringe. You're going to take your 30 gauge needle, which is in the pack, take this off the air filter, and put it on the syringe, label it as gas, and just be sure to tell the surgeon that you have 3 cc's of pure gas to administer. Okay, so the only time you will probably see the system different is if the surgeon's going to ask for a mixed gas. So that would involve using a 60 cc syringe instead of a 3 cc syringe. Same line setup, the only thing that's swapped out is your filter is attached to a
60 cc syringe.
But again, before you connect it to the line, you want to make sure that you have gone back and forth just to make sure you got rid of any impurities. And then just attach it to the circuit as you were. I'm not going to displace the gas again. I don't want to waste it. So we've already gone through the same setup. We have displaced any air into the 10 cc syringe, and now we are ready to put gas into the 60 cc syringe to administer. And again, you want to have the gas as pure as possible in the 60 cc syringe because the surgeon afterward will mix it to dilute it. Okay. Just going to increase the PSI a little bit because we're dealing with a big system. Okay, and it's again, it'll be a quick process. I'm going to turn it on, and you'll notice it expanding. You have a bit more time. Okay. Okay, so now we have 60 cc's of pure gas in this syringe. The surgeon will mix it how they like. So they could possibly, if they wanted to do 50% gas, they would dispel 30 cc's of the gas and then draw back 30 of air. And you can be reasonably assured that that's about a 50% gas. But As long as you hand up the syringe to the surgeon and tell them you have 60 cc's of pure gas, they are usually more willing to mix it themselves. So don't worry about the concentrations at this point. Just be sure to tell them that you have 60 cc's of pure gas so they know what they're working with. Okay. Now, next we will go over the importance of the wristband. Okay, so this is the wristband that you'll want to put on your patient after they have a gas bubble placed in the eye. It has the 2 different gases on each one, so you could always ask the doctor or the surgeon what percentage of gas they used in the eye. If it's Dr. Ma, it's probably going to be 100%. So you would say sulfur hexafluoride, which is SF6, is right there, and you would probably just put 100% for the pure gas. It's important to fill this out because usually patients are restricted in what kind of travel they can go on when they have a gas bubble in the eye. If they were to travel to higher altitudes, that could affect the pressure in the eye and cause more damage. The other thing is important to note is telling ACU because certain anesthetics can displace the gas in the eye, so that's important for any kind of future surgery they might have in the near future, so anesthesia knows so they don't give anything harmful to the patient. So very important, make sure you fill this out, put it on the patient, write a nursing note, and hand it over in ACU that they've had this procedure done. Okay, I hope that helps alleviate any worries when using gas. If you have any other questions, please find the Ophtho CRN.